Hello, welcome to Doctor Talks. This is your host Vivek. Here we chat with the best doctors about diseases and conditions they treat. Our guest today is Dr. Geeta Sundar. Dr. Geeta Sundar, having completed her MD in 1979, has over 41 years of experience as a practicing doctor in internal medicine. Being amongst the best medicine specialists, Dr. Geeta Sundar constantly strives to provide the latest and the best medical services in the field of internal medicine. She has also done a course on medico-legal law from Symbiosis and a 15-month certificate course on diabetes from CV Hospital and Research Center for Diabetes, Chennai, based on the course from Johns Hopkins, USA. She has worked as an honorary physician in several hospitals, including Dr. B.L. Kapoor Memorial Hospital, Delhi, and Pune Hospital and Research Center, Pune. At present, she has her consultancy practice at Pune. Dr. Geeta is a prolific writer and has been writing health books since the year 2002, and two of her books published by Macmillan are bestsellers: Health After 40 and A to Z of Bone, Muscle and Joint Diseases. Her latest health book is Self-Manage and Reverse Your Diabetes. Incidentally, her fiction novel Premier Murder League, which is a murder mystery, is published by Penguin. She has also won several national level short story competitions. It was kind and generous of Dr. Geeta to agree to our request for this podcast. We will be covering a whole gamut of health topics which are important to many of us who are in our 40s or would be entering that life stage soon. Welcome, Dr. Geeta. I'm honored to have you here. Do you want to give us a little bit of your background and how you got into writing about health?
Hi Vivek, thank you for giving me this opportunity to share my thoughts. I used to write articles for Times and Indian Express, and I kind of got into the habit of preserving all that I wrote. Then one fine day, way back in 2000, I thought, why not compile everything into a book? That was how my first book, Health After 40, came into being, followed by others.
Dr. Geeta, what made you choose to talk about the topic health after 40? Though it is a holistic topic, the scope of health areas it spans is daunting. So, I want to understand why you chose this subject.
At 40, we are like the Greek god Janus, who looks both to the past and to the future. January is therefore named after him. Behind us is the life we have lived to the full, including birth, infancy, education, career, marriage, and children, each following the other almost without a pause, leaving us no time to take stock of our lives. Ahead lies the future, which could be another 40 years or more, given the general increase in longevity. So I thought 40 is the time for a person to learn about the right way to age. There are also widespread misconceptions about health, which at times can prove outright dangerous. So I thought it is important to equip readers with scientific knowledge to be able to navigate successfully the remaining years of their lives.
You have structured the health after 40 topic across four broad dimensions. First, problems which affect most of us. Second, problems which can affect many of us. Third, problems which may affect only some of us. And fourth, some important health related knowledge. Let's start with the first group. It would be good to hear from you about the problems which affect most of us after 40.
Bowel problems like constipation, diarrhea, piles, hernia, and fissures are common in a 40 plus individual, and we should know how to handle them without harming ourselves, as also other burning problems called hyperacidity, indigestion, and reflux. Complaints of eyes, teeth, nose, and ears become frequent as we grow older, and it is useful to know how to take care of these organs which have served us well and with proper care will continue to do so for many years to come. An aging skin needs extra care, and some of you may want to know about the latest advances in cosmetic techniques, so a few of these have been included. Bones and joints also need special attention as we grow older, and hence their care, as also management of arthritis, spondylitis, and osteoporosis have been included. You will be happy to know that I have also included simple exercises for each joint. We all experience headache and giddiness sometime or the other, and we should know their causes and methods of treatment. That is why I will choose to talk about these topics in the first section as the commonest problems likely to affect us after 40.
Which are the problems addressed in the second part as problems which can affect many of us?
Diabetes, hypertension, and heart disease have reached almost epidemic proportions in urban adult population, and the importance of prevention, need for proper control and management of these in order to avoid complications, especially with lifestyle modification, cannot be stressed enough. These are known as silent killers because sometimes there can be no complaints and they can cause irreparable damage to the body before being detected on routine checkups. By heart disease, I mean ischemic or atherosclerotic heart disease or heart disease that is due to hardening and narrowing of blood vessels. Another frequently seen problem in a 40 plus is that of thyroid deficiency, and one must know what signs to look out for so that this problem is detected early, since many times weakness attributed to aging is actually due to thyroid deficiency. Obesity, of course, is also extremely common, and I therefore devoted quite a bit of space to it. Thin and trim is in today, but being thin is not only for the obvious cosmetic advantage, but mainly to avoid all the medical problems caused by obesity. Firstly, life expectancy of an overweight person is less than their trimmer counterparts, and they are also susceptible to diabetes, blood pressure, especially if the person is pear-shaped, that is, carries more girth around his tummy, as also arthritis, varicose veins, spondylitis, hernias, uterine prolapse, and delayed wound healing. Operating on, transporting, and handling an obese patient is also very difficult. These problems will be included in the second part of our discussions.
Which are the problems addressed in the third part as problems which may affect only some of us?
With the kind of stressful life that we lead, problems of mind are becoming increasingly common. It cannot be emphasized enough that people with mental problems should be encouraged to come forward and get themselves treated. As with newer therapies, it is possible to carry on their routine activities and to be a part of the mainstream. There is also a need for changing public opinion to prevent ostracization of these patients, who are no different from those having diseases of the body like hypertension and diabetes. Since stress can also cause many physical problems, it is important to know how to handle it with attitudinal changes and other methods. Next, if there is one fear that all 40 plus have, it is the fear of paralysis or stroke and becoming dependent on others. So the knowledge of why it occurs, as also how to prevent and manage it, is very essential. I have also included a few very useful rehabilitation techniques to hasten recovery after a paralytic attack. Incidence of cancer is also increasing with rise in stress and pollution. But with early diagnosis, it can be curable, and hence correct methods of self-examination of our bodies and the importance of regular medical checkups have been emphasized. Two other common anxieties as we grow older are those that arise out of menopause and the fear of sexual decline. Both these problems need to be put in their proper perspective, including pros and cons of newer treatment modalities. Parkinsonism is another problem that I thought needs to be talked about. It is quite common and people need to understand it. Genes and genetic diseases will be discussed. In fact, genes play a major role in increasing susceptibility to lifestyle and other diseases. And so, I thought this topic is of special importance.
What would we discuss as part of useful health information?
I will talk about important health-related knowledge that a person above 40 should be aware of. This includes nutrition and diet. Also, as important as what and how much to eat, knowing that the excessive intake can prove toxic to the body, especially excessive intake of supplements, is very important. How a tonic can become a toxin will therefore be discussed. Some complaints like fever, pain, and swelling are actually good for us within limits, and why they should not be haphazardly suppressed has been emphasized. Some newer investigative and surgical techniques have been explained. Dangers of self-medication is another important topic. Patients also need to be made aware of their rights and how to exercise them judiciously. Also, at least one member of each family should be trained in first aid. And some basic knowledge for everyone is useful as it can save lives in an emergency. This includes cardiopulmonary resuscitation or CPR after a heart attack, especially when one is alone without any help. Medical checkup, if performed regularly, will help in early detection and better management of disease. So, to that end, a list of suggested tests in men and women has been included. What happens to different organs of our body as we age is the final part of this section.
In your view, why do you think many of us fail to take care of our health? Is it lack of information, guidance, or just the right attitude and understanding of its importance?
A little bit of all, I would say. Regarding information, nowadays it is not lack but want of correct and authentic information that is a cause. Lack of correct attitude is also a problem. We ignore information provided, do not bother about preventive aspects of health, and yes, do not recognize importance of new symptoms or any change in our bodies. We postpone things thinking it is not going to happen to me. And then when it does, it may be too late.
Dr. Geeta, thank you for taking time out to talk to us. I believe we have a great start and we look forward to this interesting journey to understand and subsequently manage our health after 40.
Thank you, Vivek. It was my pleasure to be on Dr. Talks. I look forward to our subsequent discussions on health after 40. With the kind of growing anxiety and general deterioration in health that we see around us, especially with the current corona pandemic, I feel there is a need to guide people on how to take care of themselves, especially after the age of 40. And I will be attempting to do this in future sessions.
Dear listeners, I'm excited to discover with you the key aspects of health after 40. In subsequent episodes, we will cover many health topics which will be of interest to you, like hyperacidity and reflux, paralysis, thyroid deficiency, cancer, etc. Please spread the word and make sure your friends get the opportunity to hear Dr. Geeta Sundar and take advantage of her advice to live a healthy and happy life. Cheers till we meet next time.